So hello everyone. So today we will study about the meningococcal vaccine. So meningococcal vaccine, why it was made? Because of high fatality rate of the this disease, meningococcal disease, especially the brain fever, the dimagi bukhar. So this vaccine was uh, discovered to prevent against meningococcal disease. This meningococcal disease, basically, it is caused by a bacteria called as Neisseria meningitidis, which is a gram-negative bacteria, and shape kaisa hai? Bean shaped, and having a polysaccharide capsule. Okay, it is a Diplococcus bacteria. Also, what is the natural reservoir? Which is the only natural reservoir for this is human being. All right. So this meningococcus disease now, it is not a single disease. It is a spectrum of many diseases which can manifest as meningitis, septicemia, pneumonia, myocarditis, pericarditis, arthritis, or even Waterhouse-Friderichsen syndrome. Means not only restricted to the brain, it can involve lungs and multiple systems of the body, multiple organs of the body. All right. So this vaccine was discovered to prevent against meningococcal disease. So let's talk about this meningococcal disease now in detail. This meningococcal vaccine, which was discovered to prevent against this disease, it is basically it was discovered as bivalent vaccine initially and also quadrivalent. This bivalent vaccine, it is not currently in India. It is not used in India. Mainly what we use is a quadrivalent vaccine, basically containing 4 serotypes of meningococcus, Neisseria meningitidis mane, and it is a type of conjugate vaccine. Okay. And in India, the most commonly used is Minectra. Minectra vaccine is basically made by the Pasteur Institute, which we use all over India. All right. So this is a basically meningococcal conjugate vaccine. Meningococcal conjugate vaccine containing 4 serogroups A, C, Y, and W135. So basically, how this vaccine is made by using 4 microgram each of these serotypes, which are further conjugated to the diphtheria toxoid. So whenever you will see the Minectra vaccine, diphtheria toxoid is also mentioned over that. Why it is used? It is used as a carrier protein for these serogroups. And how much it is amount? 48 microgram. Okay. And which kind of vaccine this is? This is a lyophilized vaccine, means it is freeze dried. All right. And the diluent is simply sterile distilled water. Dose for universal dose is 0.5 ml, and the route is intramuscular, deep intramuscular route. Okay. Now we talk about very important thing, that is its schedule. Basically, as per IAP, Indian Academy of Pediatrics, we start it from the 9 months onward, okay, up to 23 months. Basically, there are two primary doses, which are given at interval of 12 weeks, means at the interval of 3 months. For example, if a kid has been given this vaccine at the age of 1 year, then we will give it at 15 months of age. But if this vaccine has not been given till 2 years of age, then you will just give a single dose, of 0.5 ml deep intramuscular. I hope it is clear till now. So this was all about its dose, schedule, and route. Okay. Now coming on to its side effects. It has just simple, just like all other vaccines, it has 3 side effects. Just like other vaccine, we say like pain, okay, swelling, fever, etc. But in some cases, when it was seen that it is given to adolescents, there has been found that it can be associated with Guillain-Barré syndrome. Okay. Now, one more question. Up to which age we can give this vaccine? We can give this vaccine up to the age of 55 years. All right. Especially in the high risk groups. So we can revise, like initially 9 months to 23 months of age, we have to give 2 primary doses. First and second interval should be at least 12 weeks, 8 to 12 weeks actually. But if you have to give at more than 2 years of age, you have to give single dose. Apart from that, there are some special cases, some high risk groups in which we can give this vaccine. Okay, so for example, in children with complement deficiency, we can give, okay, 2 primary doses, just like at the age of after the age of 2 years, 2 primary doses, which can be 12 weeks apart. After that, booster every 5 years. Okay. Similarly, with sickle cell disease, hyposplenia, asplenia also same. Okay, 2 doses at least 12 weeks apart. But similar related to this, if somebody has to undergo splenectomy, then first vaccine at least should be given 2 weeks prior to splenectomy. Always remember this point, very important. Thirdly, for international travelers, especially to the areas, having endemicity of this disease, so universally what we say, he at least minimum within 5 years before travel, this booster should be given. Okay, person should be vaccinated before at least within 5 years of at least 5 years before travel to that area. Also, for HIV patients, single dose of 0.5 ml. All right. Other than that, there are some other cases also. So these are all high risk cases. Apart from that, there are some other cases also. For example, patient. I'm sorry. For example, patients who go for Hajj pilgrims who go to Makkah. Okay. So for that, at least 3 years, within 3 years before, it should be given this vaccine. So, for example, if somebody has to go in 2024, right? So, starting from 2021 to 2024, one vaccine should be given of this meningococcal. Similarly, for healthcare workers, again, 2 primary doses, again, as I told, 8 to 12 weeks apart in case of healthcare workers or lab personnel. Also, after that, booster every 5 years because they have to be exposed every time. They are exposed to this disease, so they need a booster every 5 years. And lastly, for close contacts of patients with meningococcal disease, single dose of 0.5 ml this Menectra should be given. So this was all about the meningococcal vaccine. In the next session, we will come with the